right. Uh, Good afternoon, everybody. Hello and happy Juneteenth. Welcome to our discussion on racism, inequality, the U.S. health system. We're going to kick off right now. First of all, my name is Gilado. I'll be moderating today's discussion. As my day job, I'm co-founder and CEO of RubiconMD. We're a New York-based digital health company on a mission to democratize medical expertise. We do that by enabling primary care clinicians, what we call e-consults, or specialist insights. I'm privileged today, and through my work with RubiconMD, I've gotten to know the three panelists that we have joining me here today for today's discussion. All three of you guys are forces of nature in your own right, friends and people who inspire me through the work that you guys do. So why don't we just start here by having you guys go around and introduce yourselves, and then we'll kick off with the discussion.
Everybody, this is Errol Pierre. I'm the Senior Vice President at Health First for State Programs. Health First is the largest nonprofit Medicaid and Medicare health plan in New York State. We have roughly 1.5 million members. And our board consists of some of the most prestigious hospitals in New York: Montefiore, NYU, Mount Sinai, Northwell. And we are a fully capitated, value-based system plan. Prior to Health First, I was the former COO of Empire Blue Cross Blue Shield. I'm also a professor in health economics at several schools, and I'm currently getting my doctorate degree in business and healthcare.
There have been a lot of things that we've been talking about here in general over the last several weeks, but maybe, give us how you're feeling too, but also what's been left out of the conversation and the discourse to date. Like, what's important for people to understand that's not being spoken about?
Sure. I've been thinking about this question for a while. The best analogy I can give, and it's morbid, so I apologize, but it's like being at a funeral for a close loved one, but you're the person organizing the funeral for the family. So what does that mean? You know someone passed away and you want to mourn, but as an executive at a company, I'm worried about the employees of my company. How are they feeling? What are they going through? And then there's a nervousness and awkwardness to talk about what's happening. So I'm also lending myself to non-Black employees in a way to say it's okay to listen. It's okay if you fumble the words. It doesn't have to be perfect. Here's what empathy looks like. And so that's a bigger focus for me. Then I'm talking about my family. How are they doing? I have a 95-year-old grandmother. I have a 2-month-old granddaughter. I haven't seen them in 4 months because I can't. So I'm dealing with that, as well as other people that I mentor. My neighborhood in the Bronx, Fordham was looted. All of those businesses are minority-owned businesses. That concerns me. And then again, I'm serving 1.5 million members, lowest income members, no disposable income, essential workers that have to go outside. They don't have the privilege like us to work from home. They're in their community and they're working their hardest just to survive. And so I haven't mourned yet. I haven't taken my time to understand what this all means, just because it's like you're at the funeral and you're worried about everybody else. You're worried about, does everyone have a seat? Is everyone okay? They want to tell you they're sad, so you're talking to them. And so I've just been in a rush since COVID, and then this, like I literally haven't stopped. And so that's been sort of how I'm feeling. And I know at some point I got to take a break and decompress and sort of digest everything that's happening. I think what hasn't been mentioned is the intersectionality of both events. So I'll just break it down like this. Amy Cooper incident happened at 8 a.m. in the morning in New York City. George Floyd happened later that day in Minneapolis. It was on Memorial Day. So it was on a vacation day when you think about the men and women that gave their life to this country. And George Floyd, people died for George Floyd's freedom, yet his life was taken away by this country, right? And it was on for all the world to see on all the cameras. And so in that one day, on a holiday, we got to see the full spectrum of systematic racism there in front of our eyes, because two men that walk totally different lives. You have Christian Cooper, Harvard graduate, LGBTQ community, New York City, from a donating liberal person who was walking their dog in Central Park to Minneapolis, a cop that's trying to see if someone used a fake $20 bill and actually ended in death. And the police was weaponized in Central Park. So while Amy Cooper may have called the cops in Central Park to try to get Christian Cooper, they actually were dispatched to a convenience store in Minneapolis. And so that's the thing I think that people don't understand, the intersectionality of those both events that happen all in one day. And so from the perspective of me, right, so when someone calls 911 and they say a Black man did something, I run in Central Park. They could have been looking for me. And then when they approach you and you know you did nothing wrong, you know you have to act respectfully, you know you have to answer their questions. And I think that's what systematic racism is. It's like, despite doing nothing wrong and minding your business, you still have to yield to the structure and the power that's there. So for me, I think what's not being talked about is that it shows, as a Black person, no matter what I do, I can't dress better, I can't speak better, I can't have a higher degree, I can't live in a better neighborhood. There's literally nothing I can do to prevent what's being done to me, to the members I serve, to my employees, unless I get the help of people that can actually change it.